In Tairafedi, we are encouraging people to come and get testing. If you have symptoms of fever or cough, sore throat, runny nose, loss of the sense of smell or taste, these are all potential symptoms of coronavirus, and we would love for those people to come down and be tested. I'm Dr. Patrick Ney. I'm one of the GPs that works here in Gisborne, based from the Three Rivers Clinic, but presently I'm working here at the War Memorial Assessment Center involved in the coronavirus testing. We take extraordinary measures here, both to ensure the safety of the staff and also to ensure the safety of patients coming through. So we're wearing extensive personal protective equipment. We have procedures in place that allow us to ensure that there's minimal contact, and we ensure that everything is cleaned and wiped down, etc. So the risks are very, very, very low. Wearing PPE obviously provides a good protection for both us and the patient. The challenges are you're wearing multiple layers, you're dressed from head to toe, it can be very hot and pretty uncomfortable. I think part of the challenge though too is it's feel a little bit separated from the patients and being unable to provide that facial reassurance. A lot of people are fearful when they see us, dressed from head to toe with our protective equipment, a little bit overwhelmed. I think there's certainly some fear in respect to actually undertaking the swab. I think most people once they leave, they breathe a sigh of relief and they're reassured. It wasn't nearly as bad as they imagined it to be. If you have concerns about being either having been exposed to the coronavirus or maybe suffering symptoms, the best course of action is to actually contact your GP and speak with them, and they can make an appointment for you here to be tested for the coronavirus. The other option is to be self-referred, which means that you can come down to the testing center between 1 and 3, and it is open 7 days a week. We actually encourage people to do it through your GP predominantly, partly because the GP can follow up and make sure that everything is passed on and information is handled correctly, but also because doing it through your GP, you can actually obtain an appointment time, and that just smooths things out. If you come as a self-referral, you will be tested on the day, but it might take some time and you have to be patient. It can be very busy. We've had days with dozens and dozens of patients coming through, which can be a very busy day, but we're well staffed and equipped to handle those numbers. The testing, which involves a nasopharyngeal swab testing for the coronavirus, but we also assess patients to determine whether they have any underlying respiratory illnesses as well. I think as GPs, because that's the doctors who are staffing here, we're well practiced in trying to reassure patients in all circumstances because people come with all sorts of concerns when they come to their doctor. I think to reassure people that this procedure is relatively minor, that their risks of having the coronavirus, in fact, are very, very low, and that we're doing the testing so that we can ensure our community is safe when we come out of lockdown.